Okay. So we should apply, if we either the pack this, if it bleeding is from one side, even then we have packed both the knives so that it maintains the pressure on both the sides, and then we have to give the patient advices for, as I told, that so not to cuff, strain, and all these things, upright position, and see that this bleeding is stopped or not, he has a recurrence, or this anterior nasal packing has failed. Next. And sometimes with the palatal movement, the secretion and blood soaked packing will be squeezed, giving the same impression. Ask the patient to gargle and do some gargle, and then we examine again that there is a bleeding in the nasopharynx or not. Mostly it is the old blood which is there, which is when we do the gargles, we can see that it is anterior nasal packing as well. Instead of this ribbon gauze, the Surgisil and Maricosil, these can be used, especially in the surgical cases when we are operating, it is bleeding, it is done, they are not in this outdoor setup. Next. So, and I told that all patients who have been done as nasopharyngitis, they should be put on some staphylococcal antibiotic for prophylaxis, so that there should be no infection in the sinuses, and so we have to remove this up to after 48, but very rarely up to 72 hours. We leave this packing there and then we remove it. Then if there is this bleeding is profuse and not stopping with the anterior nasal packing, or it is starting from the posterior part, especially from the nasopharynx, the posterior part of the septum, which is mostly the cases in the old age, adults and old age having hypertension, their posterior nasal packing is done. Posterior nasal packing, previously we were doing with just by using the ribbon gauze. We make this surgical gauze with 3 to 4 surgical gauze. We make a pad and then tie 3 strings with it. We pass the Foley's catheter from the one string and we tie the one part and the other Foley's from the other nares, and we part the second part and we do and pull it so that this ball fixes in the nasopharynx and it stops the bleeding from there. Then after that we do the anterior nasal packing again. But now these are balloons, these are available. These are already tripod balloons available, and this can be done for the nasopharyngeal or the posterior bleeding. These are expandable and water is used. First of all, we have to check this, that there is some leak or not, and how much we have to take the record, how much the water we have put in. Okay, next. Always test this before placing, and balloons with water and not air, and that it is for the ENT people to how to apply this. And when we do this and when we tape it outside, we should take care that it should not be, especially when anterior nasal packing we are doing and are tying on the septum, it should not be very tight, otherwise it can cause the necrosis of the nasal ala or something. We should avoid this by repositioning or put some these pads on this under it. For posterior nasal packing, it varies according to the patient's particular need, but mostly it is from 2 to 3 days, 48 to 72 hours, it is put it there. And after that, we have to remove it and see. So mostly the bleeding stops. If it does not stop, we can do a retrial, second trial, and see. And in the meantime, we see that how is the condition of the patient, whether if due to more bleeding there is some blood loss, or there is a patient is has to need of some blood replacement or something. Next. So these patients for this nasal packing mostly done in the outpatient setup, like our setup, and but hospital observation and admission is needed. If it is after filling of this packing, or it is more and profuse with padding, or there is some other concomitant diseases which are hypertension, severe hypertension, or coronary artery diseases, and in which the patient need a supplemental oxygen, and oxygen saturation should be monitored, and the blood chemistry should be done, and all these things. Next, to rule out what is the how much the blood loss, and if it is needs a replacement or this replacement, or what are the causes for this, because this epistaxis or bleeding from bleeding through the nose is not it is just a symptom. It is not a sign. We have to diagnose what is the causes for it. So if there is some cause for it, and for we have to some bleeding causes, for have to refer for the hepatologist. Or there is the local causes which are neoplastic causes, so like tumor or something, we have to treat by the ENT setup. So this is the showing the summary of our this talk. It's a very simple. I have done this that we have do this anterior packing and posterior packing. Left side showing the anterior packing. We just pinch the nose and cold compression and see for 10 to 15 minutes it's stopping or not stopping. If bleeding is stopping, okay, then we have to observe for this that further bout is coming or not, and we have to see some ENT doctor to see what was the cause for that. And if it is not stopping with the this emergency pinching and all this, then we have to come to our clinic, and we see that it needs the examination will show that it is this visible, this localized area is the localized. It can be cauterized, either chemical or thermal, and then electrical. And then if it is with cautery, it is not stopping, or it fails and we cannot cauterize, then the packing by anterior nasal packing or posterior nasal packing. And in the meantime, we have to give the antibiotic and further checkups to rule out what is the cause and how much the blood is lost, and it needs a replacement for there. And so it is there. Thank you very much. It's just our time. Any questions from you?
There is a question.
Okay, my 6-year-old daughter bleeds frequently from the nose, especially the right side. She now was his forwards forearm. Okay, as we have discussed, there are a lot of causes. The majority of the young child, there is no cause for it, and we call it idiopathic, and we have to observe it. And sometimes this hot weather, climatic changes can cause this bleeding. So we have to rule out this. But as you told that she has this habit of putting some foreign bodies, so it's better to examine there that maybe some foreign body, interbody there, or there is only for the local cause. If there is there is no cause for it, no foreign body, and there is just a very small type of this amount of blood loss is small, so you can do the this first aid, like pinching the and applying their cold compression, it can stop. But if its frequency is more, then you have to rule out, as I told, that there are systemic causes for it. So you can bring to any doctor, especially the ENT doctor. He will see the local examination, will confirm that there is some other cause for it, or if he will have some purpura or something forbidden. So bleeding profile is done to rule out the other causes. And if there is cause, we have to treat that cause. Other locally, if it is trivial, it will stop with your pinching of the nose and cold compression. Or if it is not, then we have to go for this anterior nasal packing or posterior nasal packing, depending on it. But usually, as I am for the last 20 years in this medical center, all our patients were having this. They could stop with pinching. 1 or 2, we have to do the anterior nasal packing. One patient we referred there, he was a young adolescent from India, our staff, the kid of staff. So they diagnosed there's a nasopharyngeal angiofibroma was there in the nasopharynx, which was causing. He remained there for 2-3 days, and then he went to India, operated there, and he is happily. So see, this is only the symptom, epistaxis. If it is a small amount of blood loss, a trivial, we can stop it at home by this pinching the nose, opening the mouth, proper position so that it does not trickle in the airway and causes some other problems. And examination will reveal what is the cause for it and to rule out the cause and to treat the cause. Any other question? Thank you very much. Thank you. It's a simple thing. Okay. Okay. I hope I have explained, and it's very simple thing. I made it try to make simple. And thanks for listening to me. Thank you. Jazakallah. That's it.